We're going to look at the cross hand stretches for the shoulder to help to increase range of motion in rotation, elevation, and functional activity. So coming down with the cross hand technique, it's just biomechanically efficient for you to cross your hands over the body part. We're going to do a fascial release where we take up the slack and hold the tissue for a period of time, usually about 1.5 to 2 minutes, waiting to feel for the softening or the release. Now position the shoulder in whatever angle that they have the limitation of motion. So say she was getting painful limitation at 90 degrees of abduction, I put her a little bit below that 90 degrees. I do want the arm hanging a little bit off the table to get extra stretch, unless it's uncomfortable for the person. In that case, I might use my body or put a pillow underneath the arm to give her support. But we're looking to get as much stretch as possible. If you found that she's very tight, typically through the pecs, anterior deltoid region, I'm going to put one hand just beyond the attachment of pecs and anterior deltoid, and the opposite attachment as well. So argin to insertion, a nice cross hand stretch, take up the slack and hold. So it's separating from argin to insertion to lengthen the muscle. Take care here that you're not compressing the person's anterior neck, of course. Depending upon the patient's size and the size of your hands, that could be an issue. Some people like to do it in this position, although you're not as strong as you are if you're crossing your hands with horizontal adduction as the imposing force. Sometimes I like to put a hand right between the breast tissue on the sternum so it's not invasive to the ladies, but you could still get a nice stretch. And when you're doing these stretches, test first. Is it tight going this way, this way? Is it tight going this way? Which direction, when you test the tissue, is the soft tissue restricted? And so here, especially coming above the breast tissue, pec minor area from the upper ribs, very nice to get in there. Don't compress the brachial plexus, right? You want to get in, and I could even get a little arm distraction here at the same time. So I would take up the slack and hold. Think in terms of your direction as well when you're doing your cross hand stretches. What direction was most limited? Typically, when we did our skin glide, we saw that inferolateral is most restricted. So place your hands in a direction and see. If I pull them straight apart, is that more restricted? Or if I glide them with a little torsion, one way or another, what is the more restricted angle? Take up the slack and hold at that angle. So you get a nice stretch through pecs, or you get more a little focus on the anterior deltoid if I'm stabilizing from the acromion down to deltoid tuberosity, and adding a little bit of distraction of the shoulder at the same time. So I could have done that also by cradling the arm and just let them lean against your body. I could pin down the muscle proximally, so here from the acromion for the deltoid, and then distract distally to get a nice opening of the fascias. And you can do that at different angles of the range of motion. So see what angle that they're most restricted, place them at that angle. If that's too painful, back off just a little bit, right? So you want to keep it within the tolerance of the patient at all times. And I could then hold that for that half a minute, 90 seconds, minute and a half, 2 minutes, whatever time it takes until I feel a softening effect. Now that softening effect to you will feel almost like the arm is telescoping a bit, almost as if it's growing longer at the point it releases. So you have initially, you apply a stretch, everything is still. We call that a still point. So you're waiting for the softening effect. What should the patient be doing while you're taking your time with this? Breathing. So Elena, breathe into your belly, feel your hand in your belly, and just pay attention to very gentle, soft breaths into your belly. So you could really feel them slow down and ease and relax. Because relaxing helps those muscles to release as well. So come into a new range of motion. I felt a little release. I went into the next barrier. So barrier by barrier to each angle of limitation. That's our barrier. Hold until it softens, and then move on. So cross hand releases could also be done with some participation of patient stretching. So we're going to open up the arms here on both sides and let them hang. Comfortable? I kept her cervical spine in a little bit of neutral with just a towel roll, whatever you have for that, to open up the pecs across both sides for that kyphotic posture, the forward shoulder. You can then do a cross hand across both sides from the anterior shoulder. If I cup the humeral head in each palm, as opposed to digging in the palm heel, which can be really obnoxious, so just nice cupping, conform your hand to the body part and stretch, and breathe in where you feel the stretch. And as she breathes in, everything opens up around the chest. Very, very nice. Getting those shoulders back, because later when we do our scapular stabilization and getting those scapulas in neutral to restore our scapulohumeral rhythm, we're going to want to have the pecs more relaxed, so she's not fighting tight pec tension when she's trying to do her scapular stabilization exercises. I could have done the same stretch this way. So depending upon what's more comfortable for the patient, what's more comfortable for you, you could make the stretch stronger by putting a towel roll underneath her shoulder blades or a foam roll to open up even more, to get a little bit more thoracic extension. And breathe in. So you get a nice opening up for the chest for horizontal abduction and improved posture. Help them out of the position because it's a little bit of a strain to be hanging like that. And if it is a strain, put a pillow or support underneath the elbow so you're not getting the hyperextension.